Hello, Hudson County. I'm Dr. Alfredo Rabines, Chief Medical Officer of Bayonne. Welcome to Hudson Health. I'm here today with Dr. John Rimmer, CMO at Hoboken University Medical Center, and with Dr. Angel Lazo, our leading internal medicine physician at Carepoint Hospital. Today we have several topics to discuss with you, and we'd like to approach a little bit of preventative health and really focus on diabetes. It is Diabetes Month, so we'd like to give a little bit of information on that and the services that our hospitals can provide for you and your family. Dr. Lazo?
Yes, hi, welcome. Thank you once again. Let's talk a little bit about diabetes, because diabetes, especially in this community, is extremely prevalent. One of the neat things in Hudson County with Carepoint is that Carepoint actually, all three hospitals are actually teaching hospitals. So not only are the patients getting some of the best doctors and nurses, but we are on the cutting edge of really population health and what the community needs. And we're training actually the doctors for the community where you guys are going to be living, the patients and so on and so forth. So we're very proud of that. Now, one of the most prevalent diseases actually in Hudson County is actually diabetes. Diabetes is roughly about 9.7% of the population. But especially Jersey City being very underserved, you see a lot of African American, Hispanic, Asians, which again runs a much higher risk for a lot of these diseases. Part of the issue is that a lot of the patients don't really understand, when they go to the doctor and you say, oh, you're diabetic and so on and so forth. They don't understand that diabetes is not necessarily just a risk factor for heart disease. It's actually an equivalent. The real money for me is actually in the pre-diabetes, which hopefully I'll elaborate a little bit about. But however, because diabetes basically means that your blood sugar is a little bit higher, your insulin doesn't work as effectively, your blood sugar is a little bit higher in your bloodstream. And again, every single organ with the exception of two main areas are not vascular. So wherever the vasculature goes, when your sugars are a little bit higher, your sugars tend to accumulate and damage those organs. And this is why you see the prevalence of heart attack, stroke, limb loss, vision loss, renal failure. I mean, these are all the things that basically diabetics deal with on a daily. Hudson County becomes a little bit more challenging because, again, the patients don't necessarily understand the disease. For example, like they'll come to my office and I'll tell them, yes, you're diabetic and we need to check your A1C. The A1C is basically the indice that we use, but it means nothing to the patient, so to speak. They see it as a number, but the number doesn't really reflect anything to them. I personally will give them the estimated average sugar, which is a little bit more important to them. Now, at Christ Hospital, basically, we started the Momentum, which is the weight loss center, and weight maintenance. A lot of these individuals that are diabetic, actually over 80% of them are actually obese as well. So at the Momentum Center, which is being directed by Dr. Edward Boylan, which I'm hoping to be able to have as a guest here, maybe in the next show, he'll be able to talk a little bit more about the Momentum program. But we are focusing a lot, not just on obesity, but on diabetes. The biggest challenge in Hudson County is diabetes requires a lot of care. They have to see annual physical examinations for their vision, at minimum, podiatry examinations, and so on and so forth. But it becomes very challenging us as caregivers because of the insurance situation, especially in an underserved area. So us, especially in Hudson County, we're very fine-tuned actually into treating these diabetics with all their issues that they have as far as their comorbidities, but especially with the issues with insurance. Like for example, we have the luxury of even having Clover as an insurance actually in our area, which again is an incredible insurance, and especially for our diabetics, most of the medications are covered and so on and so forth. So we really invite the public to actually come and check out our hospital and see all the neat things that we're actually doing, and especially with diabetes. And,
my grandmother had diabetes, and I found it very challenging for her. We had to monitor her diet and get her more education. And I'm Peruvian, so all we had was rice and beans and right. A lot of carbs. But she I think given that primary care focus on her and the family sort of like joining her journey on making herself more healthy was critical, right? So it was a very family oriented challenge, and I think that's important. I think providing that to patients is critical to their success with that disease.
One of the things actually that we're also doing, because again, you don't wake up in the morning one day and you're diabetic. I mean, it typically starts in the pre-diabetic state. So we're putting a lot of emphasis on actually as almost like a secondary mode of prevention from individuals not becoming diabetic. Roughly about 88 million Americans are pre-diabetic, and roughly about 90% of them basically have no idea that they're actually heading towards diabetes. So we have a lot of incredible programs that we're actually doing to be able to help the community in that respect.
So as we approach this month, we urge the public to make sure you focus what you eat on, stay healthy. We're going to take a minute and we'll be right back.
Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, Jersey City. Hudson County's only monument maker, serving all faiths and cemeteries. Design, studio, and large inventory on site. Cemetery inscriptions and custom orders welcome. Burns Brothers Memorials, Monuments, and Markers, 787 Tunley Avenue, just south of Secaucus Road. Craftsmanship that will last for all eternity. Burns Brothers, Jersey City, Albert H. Hopper, North Arlington. Visit us on the net.
Panapinto Properties, Jersey City, shaping the workplace with state-of-the-art office spaces and addresses your company desires. Building residences that define your home environment, adjacent to all modes of transportation with on-site parking available. The right address, the right lease. Call 201-521-9000 or visit online at panapintodevelopment.com. Panapinto Properties, building Jersey City for everyone.
Hi, Hudson County. Welcome back to Hudson Health. I'm Dr. Alfredo Rabines. We were just talking about diabetes and diabetes being a leading cause of stroke and other diseases. I'd like to turn over a little bit to Dr. Rimmer, who's going to talk about our stroke program for Carepoint Health. Dr. Rimmer?
Thank you, Dr. Rabines. So, as I've stated before, I'm a board-certified emergency physician, and stroke care is one of the leading principles of emergency care. So, what is a stroke? First of all, a stroke is essentially a brain attack. People think of a heart attack. Well, a stroke is an attack on the brain. And there's two major types. There's one where a blood vessel is blocked with a blood clot. And then there's the second type with which a blood vessel ruptures and becomes a bleeding stroke. It's important to know what the symptoms of a stroke are. And you can think of it very simply in a mnemonic called B FAST. B stands for balance. If you're dizzy suddenly or off balance or cannot walk straight, that's a sign you need to be seen immediately. E is for eyes. If you have blurry vision, especially one eye over another, or one side of your visual field is blurry, immediately seek care. F is for face. If you see your face drooping or someone else's face is drooping, again, call 911 immediately. A is for arms. If you feel asymmetry in your strength on one side or another, or asymmetry in your sensation, again, time to be seen. S is for speech. If your speech is slurred, or you have trouble finding your words, or a family member has trouble finding their words, immediately seek care. And T is for time. There's no other. Stroke is one of the most time-sensitive acuities to the overall human physiology. For every minute that goes by during a stroke, you lose millions of brain cells. In the emergency room, we have about 3 hours from onset to time where we can give very powerful medications to potentially break a blood clot in the brain. All three of our hospitals are certified stroke centers by the American Heart Association and American Stroke. And Christ Hospital has recently enabled stroke neurointervention. We're the only site in Hudson County that can proceed with potentially life or limb or function-saving intervention with which a specialist can go in through an artery in your body and go up to the brain and extract a blood clot. So if you come into the hospital and you have stroke-like symptoms, we will fast track you through our stroke program. You get a CAT scan of the brain immediately. You may require other tests. We'll walk you through the whole process very methodically and systematically. So it's important to remember, again, be fast, and every minute that goes by, do not ignore those symptoms because you can have irreversible damage. If you think about a heart attack, many people we know survive heart attacks. And they go on to live a normal life. Maybe they have to take medications every day. But overall, a heart attack is, while it's very survivable often, the long-term effects of a heart attack are often minimized. Stroke, however, can change your life drastically. You can be bedbound. You can lose the ability to see or speak, paralyzed on half your body. So not only does it affect you, but it affects all your family members, your ability to work. So stroke is incredibly important for our not only well-being, but also from a population health perspective. So stroke symptoms, seek care, call 911 immediately. And also from a preventative perspective, keep your diabetes, your hypertension, your cholesterol all controlled.
So, in the emergency department also, it's important, time is very important, as John mentioned, it's the last letter. Time is money, you have to move fast. We have Carepoint Health is very keen on innovation and using modern technology to get there. We have an application we use called Viz AI, artificial intelligence program that identifies stroke directly from a CAT scan imaging from the hospitals. So it goes directly to an app. The app analyzes the CAT scan and CTA to identify for a block or a bleed. That information goes directly to the neurointerventionalists, our neurologists, and ourselves, the ER physicians. We each get this as it is happening. This saves tremendous amounts of time. And if a patient needs critical care and attention, this technology is available at all 3 hospitals. Our CEO, Dr. Mullick, has initiated an innovation center at Bayonne Medical Center. The innovation center is designed to bring together a lot of new technologies and innovations in the healthcare setting. We've met with leaders of new companies and are trying to make partnerships to bring healthcare to Hudson County to a modern day. And to us, that's key to your health.
Ford made their first all-electric SUV a Mustang. Rapid acceleration, reactive handling, 300-mile range. You control how it feels and how it sounds. It knows you. It dials into your preferred settings. It has an array of driver assist technology. Cameras and sensors enhance your awareness and provide you with additional control. But it's more than cutting-edge technology. It's the spirit of it. It's a Mustang.
Consumer Carpets, 3408 Kennedy Boulevard in the Jersey City Heights, your one-stop store for residential and commercial floor treatments, carpeting, linoleum, tiles, laminates, hardwood floors, area rugs, remnants, all major brands, all in stock. Free estimates, same-day installation. Consumer Carpets, it's savings, selection, installation. Credit cards and debit cards accepted. Financing available. Consumer Carpets, price to fit your budget, installation to fit your schedule. On the net at consumercarpets.com. Consumer Carpets, Jersey City, 201-792-2712.
Welcome back to Hudson Health. We just had a nice conversation about stroke. We'd like to take it a little bit differently now and talk a little bit about behavioral health and how it's affected Hudson County. Carepoint Health System, 3 hospitals, have committed themselves to behavioral health at a higher level. We've partnered in a program called QUIP, which is a quality incentive program for behavioral health. It is a program that is bringing to the forefront the behavioral health challenge that we have, challenging hospitals to create additional services so that the patient journey starts in the emergency room, and when they leave the emergency room or the inpatient setting, they're connected with a facility in the community to continue their care. By continuing their care, then they have more support for themselves, for their family, and then there will not be any sort of complications, hopefully in the future, for their lives or their mental health. Mental health is a struggle. All families most likely deal with it. It's affecting a lot of children these days as well with the advent of social media and other factors. The QUIP program is a program that challenges the ER to create certain discharge instructions, follow-up, and warm handoffs to community leaders and other programs. We've partnered with Bridgeway Health. We've partnered with some of the community health centers and some of the substance abuse programs. The thing about this partnership is that it's a phone call or an email or a method of communication away from connecting that patient to a next level of care. And we're very proud of the steps we're taking to get to this level of care for patients dealing with mental health. And our psychiatrists in each of the hospitals are committed to making a change. I know at Hoboken, they're also joining in on the program at Christ. I know at Hoboken as well, there's another part of the program that we're participating in, John, correct?
Yeah, so we recognize the last year and a half has been stressful for everyone. Not only has access to mental health been challenged due to the pandemic, but the pandemic itself has revealed some underlying mental health in honestly in millions of patients around the country. Our ED, our emergency room department, has seen record numbers of mental health visits. Actually, over the last summer, almost 12 to 14% of our ER volume was patients with a mental health chief complaint. So this is a large challenge, and we've met it with a lot of new energies. Our emergency room has a mental health specialist available 24 hours a day, 7 days a week. Our hospital has geriatric, adult, and adolescent inpatient mental health units, which is a rarity for a community hospital, and we're very proud of that. And also, we have a very streamlined outpatient mental health clinic and substance abuse clinic with which we engage patients in immediately from the acute care setting of the ER. We understand that this is a very challenging time, and we don't want patients to delay care for mental health. If you let your mental health lapse, you're going to let your physical health lapse. So acquiring timely, efficient mental health services is vital for our community and our outcomes. And I know Christ also has ample mental health capabilities, and I'll turn over to Dr. Lazo for any further context on that.
Yeah, especially now in the COVID era, mental health is really front and center. This is one of the things that really has impacted a lot of patients with COVID, is the whole mental health, anxiety, depression, insomnia. However, one of the things that COVID has actually opened up, and specifically at our institutions, is telemedicine. So telemedicine has really kind of changed the face of mental health. Not that mental health patients don't need to be seen one-on-one, but mental health patients need to be seen, and more specifically, they need to be heard. And now, because of COVID, it's become pretty much universal, the telemedicine, which is extremely important, especially for our community. So.
Mm-hmm.
Newport, the luxury waterfront community on the Hudson River, offers a quality of life you deserve in one of our many high-rise towers. With amenities such as the on-site Newport Path, light rail, Newport Town Square, 3 playgrounds, dog run, upscale restaurants, retail giants like Kohl's, JCPenney, Macy's, and Target. Morton Williams and Acme Supermarket are just outside your front door. A health and fitness center, skating rink, and medical facilities are also on site. Enjoy the New York skyline from our waterfront and various parks. Manhattan is just one pass stop away, or quick ride through the Holland Tunnel. Nursery and private elementary schools all on site. 12-screen movie theater at the Newport Center Mall. Looking to visit? Stay at the Westin or Marriott Hotel. For more information, visit us at newportnj.com. Make lasting memories to cherish forever. It's incredible. It's you, Newport. Live like you want.
Hi, Hudson County. Welcome back to Hudson Health. We were just talking to you about behavioral health in the community. And post-pandemic, most of you are aware that the behavioral health issue has actually been a lot worse than it's been before. We've seen a rise in visits in the emergency department and our community centers, both from a pediatric to an adult side. Carepoint Health has 3 hospitals, as you're aware, and each one has its different personality. And I'll tell you, at Bayonne, we have a good mix of adult and pediatric psychiatric patients, or just anyone with behavioral health. We admit voluntary patients only, and we have a really good size, about 15 beds in our inpatient unit. If not with our program that we mentioned before, we are initiating strong partnerships to provide the outpatient services to our patients. Hoboken, interestingly, John was just mentioning, he at Hoboken have a larger pediatric population, right, John? And I know at Christ there's a lot of a different population as well. We can get into that, the Lazo. John, do you want to go first?
Sure. Yeah. At Hoboken, we see a large population of adolescent and pediatric crisis evaluations. We are a referral center. We have we're a psychiatric emergency service referral center for behavioral health, and especially for adolescent and pediatrics. We get referrals from all over the state, actually, for inpatient services for our CCIS unit, which is an adolescent and pediatric inpatient setting. And we know the pandemic was especially hard on children. It's something that not only adults never experienced, and the anxiety that went along with that, but from a child's perspective, incredibly distressing. They're out of school. They see their loved ones get sick or even pass. They see financial distressors within their families and their communities. And without that natural socialization that goes on and that is inherently important to children's well-being of school, it became very challenging. So we're seeing a lot of need for adolescent and pediatric psychiatric services. So if you believe your child is in need of that, we encourage you to speak to your pediatrician. And if they're in urgent need of it, if they're withdrawing, if they've shown, again, social withdrawal or feelings of even self-harm or suicide, absolutely bring them to the emergency department. You could absolutely save a life. Can't stress that enough. We'll evaluate you in the ER. We will determine the need for inpatient versus outpatient settings. And if inpatient services are not deemed needed at the time, then we will get you followed up with a child psychiatrist fairly rapidly. So again, time is of the essence with this type of thing.
Absolutely, I agree. And I know that we also have a population at Christ that has a significant behavioral health issue. In addition, there's a detox program at Christ. Lazo, you want to talk a little bit about that?
Yeah, our unit is actually voluntary as well. We deal mostly with adults, especially now with the pandemic, with a lot of the depression and so on and so forth. We are still in this country actually with an opiate crisis and a drug addiction crisis. So in Hudson County, Carepoint, specifically Christ Hospital, does have a very unique detox program. So it's not just COVID that we're dealing with, we're also dealing with, the drug addiction pandemic that's actually going in this country for a very long time. And we got a very successful detox program to help the community.
Yeah. I think also one of the challenges that I see just from my experience as an ER doc is that there's just people come in, they're looking for help, and sometimes they can't even get an appointment at a psychiatrist or a psychologist or a caseworker. The resources are very limited. It's very sad. I mean, I think it's across the country. I'm sure it's occurring. And I do know New Jersey is making a big step in that direction, providing funds for institutions and hospitals, and even the outpatient settings to be able to get those services more available.
Yeah, we do a lot of grant work, for example, in our institution. We do a lot of grants, because again, it's an underserved area. And that's one of the big fallbacks actually with psychiatry. A lot of the psychiatrists don't even take insurance. So, and in our community, we have a lot of Medicaid, for example, and very few physicians actually take Medicaid. And now, especially with the pandemic, even a lot of these psychiatrists' offices are still not comfortable opening up. So we do a lot of grant work. So not just detox, but all of the mental health issues, mostly adults, we handle at Christ.
Yeah, and also, I know for the community is not aware, there are also a lot of telemedicine resources out there also available for those who want to reach out in that manner. Licensed psychologists, psychiatrists providing services via that platform. So I encourage anyone who's in need to use those resources as you can.
Good Friend Self-Storage in North Bergen, New Jersey is a fully climate-controlled facility equipped with state-of-the-art security, packing supplies, a Refer a Friend program, and multiple loading docks convenient for commercial use. Located just off of Route 3 at 4301 Tunnelly Avenue, Route 1 and 9. Call 201-867-2444 or visit us on the web today. Good Friend Self-Storage. Let us be your good friend.
Hello again, Hudson County, and welcome back to Hudson Health. Dr. Rimmer, we were just talking about a little bit about maternal health and currently what's going on with behavioral health in that arena.
Sure. Thank you, Dr. Rabines. So we touched on the needs of the community, certainly from a behavioral health perspective, and that segues a little bit into maternal health, not only from a postpartum depression screening, but in general, the needs of a young mother during a pandemic, and the challenges that we've seen with pregnancy through a pandemic, the concerns about being vaccinated while pregnant or shortly postpartum, or planning pregnancy, and how you coordinate your vaccination with that. But the evidence thus far has shown that vaccination is safe with pregnancy, and most obstetricians are encouraging vaccination for pregnant women, or certainly or women who are planning to become pregnant. Hoboken University Medical Center is proud of our mother-baby program. We do about 1,000 deliveries every year. We have a very modernized postpartum unit with private rooms and very nice amenities. Having myself and my wife given birth in the city many years ago, I would say that the facilities at Hoboken match or beat most as far as the amenities any of the centers in New York City. So we want women to feel comfortable delivering on this side of the river and then not have to be in labor in the Lincoln Tunnel, and know the expertise you're going to acquire is really top notch. Our obstetricians are incredibly well trained, all trained at very academic institutions, most of them in the New York metro area. And also our gynecology services are top notch. We have some gynecologic surgeons that are internationally known and perform robotic surgeries for gynecologic issues. And we're very proud of that service line and looking to honestly expand that and awareness to the community. So if you're a young expecting mother in Hudson County, we welcome you to come to the hospital to tour the unit, to meet our obstetricians, our pediatricians, our nurses, and even our ER. We have a dedicated obstetrical ER. If you come into our ER with an obstetrical issue above 20 weeks, you will be seen dedicated by an obstetrician. That's 24 hours a day, 7 days a week. And again, we have a pediatrician in-house, 24 hours a day, 7 days a week. And we're very proud of that.
That gets me excited. I mean, I know you have two lovely children, John. We are actually having number 2 on the way soon. So we'll think about Hoboken when that comes along. We're due next year, July area. So maternal health and baby health is critical, and it's very close to our heart at Carepoint Health. So thank you again for your time. Have a wonderful, wonderful day, and we'll see you again soon.